and I'll drill through the skull. And it takes a little bit of time, but you drill through the skull. This is a procedure that I actually do at the bedside. And obviously, this should not be tried at home. Here's actually what I do, and Archie wanted to watch along. So what I do is, this is the patient, this is the skull. Obviously, what I would do first is you have to prep the area up sterilely, and then make an incision with a little knife, obviously. But what I do for landmarks, I actually measure back about 11 to 11.5 centimeters back from the nasal bridge. So I measure that with a actually ruler. And then I also measure 3 centimeters off of midline. So about here is where I measure to. And that's the spot that I'm gonna make my drill hole. And then I make an incision through the skin, spread it apart so I can see the skull. And then we have a drill here, and all this is done obviously very sterilely. And the patient is heavily sedated. Typically they're unconscious because they have a head injury. But then what we do is I take this drill and I'll drill through the skull, and it takes a little bit of time, but you drill through the skull, and then the drill will slow down. When it's going to go through the inner part of the skull, the drill actually slows down, and then you can tell you're getting close. What happens is the drill will actually pull it. So the drill starts to pull through, and then you pull the drill out. And then I have a little stylet here that I kind of poke, and you have to poke through the covering of the brain to make sure you have a big enough area that you can put the tube through. And then the tube is placed over an inner stylet like this, and you basically, you go right angles to the skull, and I pass the tube right down into the brain until I hit the fluid cavity. Once the fluid cavity I enter, then I hold the tube and I take the inner stylet out, and then the fluid will drain out the tube. And then we tunnel that tube under the skin and connect it to a drainage bag, and we monitor the pressure. What'd you think, Archie?